I now give the floor to the distinguished representative of International Lesbian and Gay Association for a joint statement.
Mr. President, we warmly welcome the thematic and country visit reports presented by the Special Rapporteur on the right to health. We commend the Special Rapporteur's particular focus on the situation of trans and intersex persons. Trans and gender non-binary individuals are often deliberately or effectively denied the possibility of participation in professional sport. Lack of gender recognition laws based on self-identification and laws criminalizing trans people greatly restrict access to sport. Policies must reflect international human rights norms and should not require irrelevant clinical data or unnecessary medical procedures as a precondition to full participation. On a more practical level, states must remove barriers to participation, such as poorly designed changing rooms, requirements to wear clothing that might cause individual discomfort, and restrictions on the use of sex-segregated bathrooms. For intersex persons, a variety of sex tests are a grave problem. No single test determines gender, and there is insufficient clinical evidence to establish that, for example, women with higher levels of testosterone have a substantial performance advantage justifying their exclusion. Sporting organizations must act to ensure that their policies prohibit such practices. In the report regarding adolescence, the Special Rapporteur highlights that health services for adolescents, in particular those for sexual and reproductive health, must be sensitive to gender identity, sexual orientation, and sex characteristics. They must be non-judgmental, treating all teenagers with dignity and respect. The report notes that LGBTI adolescents are at heightened risk of mental ill health. We are pleased to note the Special Rapporteur's reference to the specific hardships that intersex adolescents often experience due to irreversible and non-consensual surgeries performed during their early childhood because of the natural development of their bodies. Mr. President, we ask the Special Rapporteur whether he agrees that states should provide trans adolescents with access to gender transition-related services, age-appropriate hormones and puberty blockers, and progressive steps towards self-identification. Thank you very much.